Welcome back to Today's Health. In this segment, we're going to talk about heart attack survival with cardiologist Dr. Samman. Dr. Samman, in this segment, can you start by telling us what are the symptoms of a heart attack?
The most common complaint that people come with is chest discomfort. And I seek discomfort, not pain, because some of us, if we ask them, are you having chest pain? They say, no, I'm having pressure, I'm having heaviness. It's something abnormal in our chest. Most commonly, it's on the left side of the chest. Sometimes goes down to our left arm. Sometimes goes up to the neck, to the jaw, not above the jaw. So if people complain, you know, my eye is hurting, that's very unlikely. My leg is hurting, very unlikely. We can get short of breath, sweaty, dizzy, nauseated. Those are the common things. But an abnormal feeling in the chest, you know, that's the common thing. Unfortunately, not all of us read the book, so we can come in with very different feeling. Some of us come in, you know, with only our jaw uncomfortable, our teeth hurting. But that's not very common, just to have that symptom. So a chest discomfort on the left side, going down to the arm, it's the most common presentation.
Now, we've often heard that women sometimes exhibit different symptoms when they're having a heart attack. Is it true that they differ between men and women?
Common symptoms are common. So women still will come in with the same symptoms, but they can come in with different symptoms in addition to that. And the older we get, we can have different things. We can get nauseated. People say, I'm having indigestion. I feel sweaty. I don't feel right. So sometimes they're not typical. They're not the classical representation. We see it probably more often in women, and we see it in people that have diabetes.
Now, if I'm at home and I think I'm having a heart attack, what are some of the critical things that I should do?
Well, the first thing, if any one of us has chest discomfort or something unusual, and you remember we talked about the risk of having heart disease. If we have risk, we're at a higher risk to have it, then we definitely should think heart. And when we do that, call EMS. Don't have your family transport you to the hospital. Unfortunately, you may be doing well, and while en route with somebody driving, things really go bad, and that's not a good time for anybody, and especially for this person driving. So call EMS, make sure somebody can open the door or have the door open for them. If you have aspirin, take an aspirin and be ready to go to the hospital. So be prepared if you're having discomfort that seems abnormal to you, especially if you're in one of that group that are at higher risk to have heart problem, or you had a prior history of heart problem.
No, so call EMS and then take an aspirin. Is there anything else that you can do while you wait for EMS to arrive?
Stay calm as much as you can. Make sure the door is open. You don't want the EMS breaking the door to get in. You know, those are the most important thing. If you're in situation where you can have somebody with you at home, that's very, very important, because unfortunately heart attack can lead to cardiac arrest, and those very few precious moments until the EMS come in, that can happen. That's the most common cause of death in any one of us that has heart attack. So if you're, you know, lucky to have somebody with you, that's very important. They stay with you. They can help you out, get you out, open the door. Those are the important things. If there's a family member with you, make sure you have your list of medication with you, because that is very important when you come into the hospital, in the emergency room. It helps us a lot to know what your history, what medication you take. This way it can guide us through giving you certain medication or not, and help us make a quick decision on the treatment.
That's a great point. Now, how important is it to seek medical treatment as quickly as possible if you think you're having a heart attack?
This is really the most important thing. What we say, time is muscle. What do I mean by that? As I said earlier, the heart is a muscle, is a pump. And the quicker we can save the pump, the better off we are. The longer we wait for a muscle, for a segment of the muscle not getting blood and oxygen, that muscle is going to die, and it's going to die without coming back. So we're going to have an area of the muscle that's not moving. So the larger that area, the weaker the pump. And the quickest way to fix it is to get the blood back flowing. So that's why it's important to seek medical attention right away. Call EMS if you have any doubt. It's better to be safe than sorry.
Now, what should a patient expect once they arrive to the emergency room by ambulance if they think they're having a heart attack?
Now with the EMS system that we have, we're very lucky. They're able to do an EKG on site. That EKG, the tracing of the electrical activity of the heart is done a lot of time at home and transferred to the emergency room right away. The emergency room physician looks at the EKG. If the EKG is suggestive of an acute heart attack, acute myocardial infarction, where we do the emergency room activate the cardiac team and the cardiac cath lab. What that means is we get called. I get called right when they get the EKG. The staff gets called if we're talking about the after hours or even during the day we're notified right away. So by the time the patient gets to the emergency room, everything is rolling already. The room is open, the staff is here, the physician is here. As I said earlier, the quickest we can get to start working, the best results we can have. Our goal is to restore the blood flow to the artery that's been blocked from the time that the symptoms started to the time we restore it in less than 90 minutes. So it's not 90 minutes working for us, it's 90 minutes from the minute the discomfort started and EMS has been activated. So you have to think about transport time, transport to the emergency room, transport to the cath lab, getting things set up. So that's why it's very important to getting quick. And that's another reason why having the emergency room, the EMS, available is they can send us the information. If you come by car, by the time you get in, you get your EKG, that's already wasted time.
Since it's so important to get that blood flowing again to that heart muscle, what treatment options are available for that?
There's two ways to approach it. The first one, which was the way we started initially, was giving a medication. Some of us call it blockbuster. It's basically an intravenous medication that tries to open the blood clot. It works in certain situations. It's good if we don't have access to a cath lab, but it has its own problems. The most commonly used approach is what we call primary angioplasty or primary stenting, which is basically doing a cardiac catheterization, taking a picture, and trying to get through that blockage to open it up mechanically. Try to get through it, open the clot, and open the blood flow. That's the most common way we like to do it, if we can do things within that time span that I talked about.
Dr. Samman, this is great information. We need to take another break. We'll continue in a moment.
Thank you.